We're going to look at the normal female pelvis as examined via ultrasonography. So in this first image here, we can see the bladder, which is located just anterior to the uterus. So this right here represents the bladder. This is the vagina down here. And then you have the cervix before we transition into the uterus. And then the fundus of the uterus is going to be located right up here. So again, you get some of those important relationships relative to the ultrasound image. So this is a very typical view of the female pelvis via, and again, in this case, we're looking at a transabdominal view of these structures. Here we have another view of the female pelvis. So we have the cervix over here on your right, and then the fundus of the uterus is up here on your left. And so this mid area right here is going to be the endometrial cavity, which is obviously where you would find a fetus in the case of a pregnant female. And in this case, we have an abnormal, or at least some type of abnormality. It's hard to say exactly what it is, but we have the bladder up above, the vagina over this direction, the cervix right about here, and then the uterus is coming up this way. And you'll notice that there is some free fluid located just posterior to the location of the uterus. And so that free fluid can be an indicator of potential accumulation of blood or other types of serous fluid. It can also be indicative of a possible ectopic pregnancy, so it should be further investigated when it's observed. Here we have an example of the ovary. So ovaries are also typically examined quite easily with ultrasound. And so you'll notice that the C's here all represent cystic follicles that are getting ready to be released once, or an egg will be released from each of those follicles during menstruation. So here, the stars here basically represent the boundaries of the ovary. And again, just a note real quick, it's perfectly normal to observe several cystic follicles in a female at any given time, at least in a female of reproductive age. So you want to keep in mind that there's always going to be a dominant follicle that's going to be the one that actually is released during ovulation. That's the term I was looking for earlier. So during ovulation, that cystic follicle is going to become dominant and then eventually release a single egg from that one follicle. And this is actually a really interesting example of during an ultrasound examination, this patient underwent ovulation. So you can see over here on the left this very large dominant follicle, and then later on in the scan, they came back to the same region of the ovary, which again is this whole region right here. And you'll notice that now it has dramatically shrunk in size. And so you can also see a little bit of free fluid here next to the ovary. So that is indicative of an egg being released. So ovulation has occurred, and now you have a little bit of the cystic fluid from that follicle that's been released. So kind of a cool image there. This is another view of an ovary. So again, you can kind of get a sense of the outline of the ovary here on the ultrasound image. And you'll notice that there's a large number, abnormally large number of cystic follicles in this individual. And so this is an example of polycystic ovary disease. Here's another example of polycystic ovary, but in the upper left-hand image, this is the ultrasonographic view of it. So you can see all these different cystic follicles. So again, polycystic because there's a abnormally large number of follicles. And then down here, this is an actual laparoscopic view of the female pelvis. So you can appreciate the fundus of the uterus up here. You can see the fallopian tubes coming around back here with the fimbriae going to be located right about the location of the ovaries. You can also see the ovarian ligaments located right here, helping to anchor the ovaries to the uterus. You can see the broad ligament, of course, coming across this direction here as well. And so again, these are going to each represent the ovaries, and so you can see how they have a large number of cysts, of cystic follicles located on their surface. And so again, this is an example of polycystic ovary. I put the image up here in the upper right-hand corner. It is upside down relative to the way that it was drawn, but it's oriented so that you can appreciate the orientation of the laparoscopic view. So again, this would be anterior up here and posterior back here, just like on this image. And so you can see where the rectum is located. You can see the broad ligament You can't see the suspensory ligaments like they're shown here in the image, but you can certainly see the ovarian ligament, the fallopian tube, the ovaries, and then the round ligament coming around to anchor the uterus to the labia majora. This is another coronal view now from a CT scan instead of from ultrasound, showing you another example of polycystic ovary. And again, you can see bilaterally that these ovaries have a significant number of follicles within them. You can also appreciate the uterus here and then the bladder just anterior to that. So now we're going to look at a couple of examples of ovarian tumors. So on the left, we have an example of the ultrasound view of an ovary, so you can tell how it doesn't quite look like what you would normally anticipate it looking like. And so when we shift over and do a CT scan, as shown over here on the right, you can appreciate this large ovarian tumor in this individual. Here's another example of an ovarian tumor in a different patient. So here we have the tumor right here. You'll notice that there's some hypodensities within the central region of the tumor, which suggests possible necrosis there. And then coming down this way, this is actually higher up in the abdomen, where we're able to see the small amount of acidic fluid or ascites located near the liver. Then over here on the right, you can see in the sigmoid colon, there's this sort of serrated tooth-like appearance along the edge of the sigmoid colon. So that suggests that there's serosal involvement of this tumor as well. So basically it's metastasizing and invading the wall of the sigmoid colon in this person. Now we have an example of a cervical carcinoma. So we have the bladder located just anterior to the location of the cervix, and notice how large the cervix is. It should not be anywhere near this size, and so this is indicative of a cervical tumor. In this case, it is a carcinoma. It is a neoplasm, so it's a cervical carcinoma. In the image below, this is actually higher up in the abdomen, so you can appreciate the IVC and the aorta, and right along the edge of those two vessels, you see these additional soft tissue masses that you wouldn't normally expect to see. And so these are enlarged lymph nodes as a result of this cervical tumor. Recall from your gross anatomy that the uterus can take a couple of different positions in a female. So most women have an anteverted, anteflexed uterus, which is shown over here on the left-hand side. So you can see where here's the vaginal cavity, anterior to that we have the bladder, and usually right about the level of the cervix, the uterus turns approximately 90 degrees from the orientation of the vagina, and that gives you that anteverted, anteflexed positioning. And the image over here to the right, you can see now a different example where the uterus is still anteverted, but now it's retroflexed. So it's sort of bending back posteriorly. And the next example, you can see where this example it's anteflexed, but now the cervix is basically in line with the vaginal cavity. And so here this is considered retroverted as opposed to anteverted, like you see here, where you get that 90 degree turn at the location of the cervix. And then finally in this image over here, now we're both retroverted and retroflexed. So again, the cervix is roughly in line with the vaginal cavity or canal, and then you can see how the uterus also is bent in a posterior direction towards the rectum. So here we have an example of a retroflexed uterus. So again, you can see the vaginal cavity coming in, and then you can see the cervix, and then the uterus where it's turned posteriorly towards the rectum, which you can see right here. There's a little bit of fluid located in between the two structures there, the uterus and the rectum. And so this is found, this retroverted uterus, and in this case retroverted and retroflexed, is found in about 20% of all women. So it's not particularly uncommon. About 1 in 5 women have it. And then I mentioned before that there's this fluid here, so I want you to think for a moment about where that fluid would be located in the female abdominal pelvic cavity. Here we have the same image just turned on its side. So this is going to be the fluid that's accumulating in the retrovesical or rectovesical pouch. Sorry, rectouterine pouch, excuse me. So here's the rectum, here's the uterus. So the rectouterine pouch of Douglas is going to be the low point of the female abdominal pelvic cavity. So that's the most likely place in a supine patient for fluid to accumulate. here we have another example. So we're going to run through a number of images here, going from the abdomen down into the pelvis in this patient. So first off, just to bring us up to back up to speed on this, so you can see the aorta, you can see the hemidiaphragms draping off of that, the spleen over here, and then the liver right here with the stomach here in the midline. You can see this patient is obviously supine, supine, where you can see the gas bubble sitting here anterior location. You can also see over here the part of the descending colon on the patient's left. And then as we move down, one more image, you can see this is the IVC right next to the aorta, and then just ventral to that, we can see the portal vein, the hepatic portal vein located right there. So we're going to keep descending, and eventually here you're starting to be able to make out the pancreas. You can also see the splenic vein located right next to that. And so as we continue descending, again, this is the head of the pancreas right here, sitting right up against the descending part of the duodenum. So the second part of the duodenum or duodenum. And so that's going to be obviously where the pancreatic duct is going to be dumping its secretions into the small intestine at that point. We continue descending. You can see a really good view of the SMA. So it's the superior mesenteric artery where it's originating or coming off of the aorta. You're starting to see the kidneys as well at this level. So again, hopefully this is a good review. And then at this point, you're starting to also note that hopefully that there's this large structure coming off of the right kidney. So again, just kind of pay attention to that as we go. You can also see this is the left renal vein cutting across right here. The other arrow over here is labeling the descending colon. So we're going to keep on descending down here. And again, here you see that left renal vein quite clearly. And again, note the size difference between the two ureters. So you can see that the right ureter is clearly much larger than the left ureter. This is going to be the third part of the transverse part of the duodenum here. So the third part of the duodenum as it's cutting across both the aorta and the IVC. As we continue descending, pay attention to the ureters. Again, note the size difference between the two ureters as we're descending. It's quite significant, of course. So this is the level of the umbilicus or the umbilicus right here. And also note that you can see the flat abdominal muscles quite well. So you can see the external abdominal oblique, the internal oblique, and the transversus abdominis. So you can actually see all three muscles there quite well. And as we're moving down now into the pelvis here, so you're starting to see the sacrum, you're starting to see the ilium there. The sacroiliac joint is showing up in the next image. Again, you can see the rectum, so part of the bladder showing up. So again, there's no uterus, so this is either a hysterectomized female or it's a male, most likely a male. You can also see the ilium with the iliopsoas muscles. Remember that these are going to be the external iliac vessels, so the vein and the artery, on both sides. As we continue descending, now notice at this point that you see this abnormality here right at the UVJ. So this is why we saw that enlarged ureter on the patient's right side, was due to the fact that there was this renal ureteral calculus right here. And then here's the seminal vesicle just posterior to the bladder, so we're not quite to the level of the prostate yet at that point. All right, so here we have another example of you can see the urinary bladder, and then posterior to that we can see the rectum. So we're going to continue descending here, and this is another example of a calculus or a kidney stone located at the ureteral vesicle junction of the UVJ.